The clinical facts, diagnosis, and medical and surgical treatments of Pyometra. For the clinical facts, it's more common in dogs than cats. It occurs mostly in middle-aged dogs around 6 to 7 years old within 12 weeks, the average being 6 weeks after estrus. During diestrus, there's a high P4, which leads to decreasing of local immunity and increasing of bacterial infection. A high amount of P4 can cause cystoendometrial hyperplasia. Local inflammation can cause secretion accumulation, which causes bacterial infection, which leads to pyometria. The main bacteria is E. coli, but it can also be caused by Streptococcus, Staphylococcus, and Pseudomonas. These gram-negative bacteria can cause endotoxic shock. The clinical signs can be vaginal discharge, found in 75% of cases, depression, anorexia, polyuria, polydipsia, and fever. For the diagnosis, we look at the clinical signs, we can do bloods and do abdominal palpation, ultrasound, and cytology of the open cervix. In the blood, we can expect to see increased total protein, increased globulin, decreased albumin, and increased urea and creatinine, and increased ALK, and increased white blood cells. On the ultrasound, we can see the uterus is enlarged and has a thickened cystic endometrium, and there can also be fluid. And in the cytology, we can see degenerated neutrophils and bacteria. The treatment in young animals less than 5 years old that are in good condition is medical. You give fluids and amoxicillin clavulanic acid and vitamin B12. You give agilpristone to decrease the P4, which opens up the cervix, and cabergoline and PG2 alpha, such as dinoprost and cloprostenol, to cause UT lysis, which also decreases P4. And you can also perform surgery. Make sure the animal is rehydrated, and you can give antibiotics. You do 2 ligatures to the caudal to the cervix, and 2 ligatures to the uterine artery.